Hey everyone, today we are talking about the causes and treatment of heavy periods. It's going to be highly informative, so stay tuned. Heavy periods, known as menorrhagia, may be caused by a few different things. If you are watching this video and you are experiencing heavy periods, it may be due to one of these reasons. Firstly, hormonal imbalance. Hormonal imbalance has to do with the imbalance between the estrogen and the progesterone, which are responsible for regulation of menstrual cycle. Any imbalance in these two hormones may lead to heavy periods. There are possible treatments for this condition. I did a short video on that. You can watch it on this channel. So hormonal imbalance may occur commonly around puberty and around menopause, the perimenopausal period. Of course, it can occur at other times in the reproductive cycle. Another possible reason you may be having heavy menstrual period is abnormal growth in the uterus. And this abnormal growth may be a polyp, maybe uterine fibroids. Usually during menstrual cycle, uterine fibroids or any growth in the uterus may compress more on the vessels and increase bleeding during menses. At other times may actually lead to increased growth of the vessels, the blood vessels, which then bleed more during menstruation. The good news is that this is also treatable. Other common uterine problems that may be associated with heavy menstrual periods include adenomyosis. This is abnormal growth of the endometrial tissue in the uterus, and this may lead to excessive menstrual bleeding. So what happens in adenomyosis is that the lining of the uterus actually grows into the musculature, and this may predispose a woman to heavy periods during a menstrual cycle. At some other times, it may be the lining of the uterus, the uterine tissue growing in some other parts of the body. And when this occurs, it may also lead to not just heavy menstrual period, but painful periods. So those are examples of problems with the uterus that may be a cause of heavy periods. And all these conditions are treatable. So you need to reassure that the conditions are treatable if you have any of these conditions. Some other females have what is called polycystic ovarian syndrome. PCOS is a common condition that may not just lead to irregular menstruation, but be a cause of heavy menstrual period. This is because of the hormonal imbalance that occurs in the condition. Be assured that this is also treatable. Pelvic inflammatory disease is another common condition in females. Pelvic inflammatory disease simply means infection of the reproductive organs. So when a woman has pelvic inflammatory disease, she may also experience heavy menstrual period sometimes. Of course, this is also treatable. Some medical conditions such as liver disease, thyroid disease, and a bleeding disorder can be a cause of heavy menstrual period. In these cases, the blood does not normally clot as it should, and so when a woman is having a menstrual period, there's a tendency for such a woman to bleed more heavily than usual. This bleeding may also involve passage of clots depending on how heavy. Some cancers can also be a cause of heavy menstrual period. such as cervical cancer and uterine cancer or cancer of the uterus. While intrauterine devices are safe generally, however, in some women, it can be a cause of heavy periods. And this is one reason why some women present for the removal of such intrauterine contraceptive device. Interestingly, some medications can actually be the cause of heavy menstrual period. If you are on blood thinners, if you are on certain medications that can make the blood thin and bleed more than usual, then you may experience heavy menstrual period during your menstrual cycle. These are some of the causes of heavy menstrual period or heavy flow. So, but you need to see your doctor for proper history, that is question and answer session, for you to be evaluated. An examination may be required, a general and then systemic examination may be required for your specific diagnosis to be made. That is it. In this video, we have discussed some of the common causes of heavy menstrual period. And for you to have an appropriate diagnosis of the cause of your heavy menstrual flow or periods, then you need to consult with your doctor so that you can have a proper history taken, you can have a proper and detailed examination, and then required investigations will be conducted for your diagnosis to be made. Then appropriate treatment can be offered to you. So do not panic if you have heavy menstrual periods. It is one major reason why an individual, a female, should present to a physician for proper evaluation and treatment. If you are watching my video for the first time, this is Dr. Soyemi. I am a family physician and presently looking at reproductive health. We have just discussed causes of heavy menstrual period. If you found this video informative, then click on the like button, kindly subscribe, drop a comment. If you have a question, you can drop it in the comment box and then I can address and answer appropriately. Watch out for the second part of this video where I'll be talking about the different treatments for heavy menstrual period. This is a common presentation, this is a common condition that women experience, and it could be very devastating emotionally, physically. It can actually affect work life, family life, and requires proper evaluation and then adequate treatment. So watch out for the part 2 of this particular video. Thank you for watching. See you in the next video.